So I'm going to allow it so that you can unmute yourself. And then that way, if you want to speak up, you can do that. Okay, so we'll get started in just 1 minute, but I will say that everything, when you do massage for yourself, it's always a really great idea to wash your hands. So if you want to run and do that real quick, or hand sanitizer, but I like the act of actually washing my hands underwater just to kind of bring myself as like nice and clean to what I'm doing. And just to kind of like slough off anything else that maybe, you know, energetically or otherwise is on you before you start. All right, for those of you that don't know me, my name is Amy Thornton. I'm a licensed acupuncturist. I was a massage therapist long before I was ever an acupuncturist. So I have been working with bodies since 2003, so 17 years. It's a long body of work. I've learned a lot of things over the years. I've talked to a lot of people about what's going on in their bodies. So I have a lot of insight into that. And what I'm going to show you today is just what you can do for your own self. So I'm going to combine some acupressure, which is just using acupuncture points and pushing on those points. And those, without getting into all the weeds of it, those points will kind of have a correlation with like something in the jaw. So I'll show you some stuff down there. So these are called distal points, like away from where we're working, and then actually how to work into this area here. I will periodically, I'm trying to look at the camera, but I'll periodically look over at chat, or if you want to unmute yourself to ask a question, feel free. I'm a fast talker, so if you're not getting something, just let me know and I will slow down, and I will do my best to try to show you like actually so you can see things. So for any time that we are doing massage, there's some rules to know. It doesn't matter what kind of massage, if you're doing it on another person or yourself. The first thing is that it's really important to just be really present with what you're doing. You don't want to just like be jamming around in there and not thinking about what you're doing. Your body kind of responds better to intentional touch, right? So I want to think about like, oh, okay, I'm right now working on releasing my jaw. So there's something there with the, putting your mind into that. And just checking everyone can still hear me, right? If anyone just wants to, we're good? Okay, thanks, Michelle. And so, yeah, really paying attention to what you're doing. I mean, we can absentmindedly massage ourselves. You're not going to hurt yourself, but it's going to be a lot more effective if you're actually sitting there going, okay, this is what I'm doing right now. Let me just close this. Oops. All right. So it's also a good idea. So when you're doing that, you want to come with a clean mind. So the easiest way that I know how to do that is to take really nice deep breaths. And what I found over the years is that most people don't know how to take a deep breath. So if I say, take a deep breath, people are like, right? And then all the breath is right here. And a lot of this actually contributes to jaw tension over time, because when we're breathing from this part of our body, what's actually happening is that we're using these muscles here and these muscles here, and they're called the accessory muscles. And so instead of using our diaphragm, this muscle down here, which is a big kind of bellows-like muscle, we're using these little guys, and they become chronically tense and tight because they're doing the work that this big muscle, the diaphragm, is supposed to be doing. And then when these muscles become tight, it shoots up and it goes into the jaw. So there's very little separation from jaw pain and neck tension. I don't find that most people have both, right? So a nice deep breath, you're gonna want to, there's a couple of rules. You wanna relax your belly, we'll just let it all hang out. Nobody can see you. You wanna put your hand right at the base here where the ribs are, that is the diaphragm. And when you breathe in, you want to go in through your nose and out through your mouth. And when you're breathing, your hand should be moving. And that's how you know you're doing it. So relax the shoulders, relax the belly, and then we're going to take 3 nice deep breaths together before we start. So I'm going to go ahead and I'm going to count. So I'm going to count to 5. Hold for 1 and out for 6. So you want to breathe out a little bit longer than you're breathing in. So I'm going to go ahead and start. So breathe in, 1, 2, 3, 4, 5. Hold, out, 1, 2, 3, 4, 5, 6. 2 more. In, 1, 2, 3, 4, 5, hold, out, 1, 2, 3, 4, 5, 6. One more, in, 1, 2, 3, 4, 5, hold, out, 1, 2, 3, 4, 5, 6. Okay, so the next thing is to get your intention into your hands. So you actually want to do like a little bit of massaging of your hands and kind of doing that. And what will happen is that your hands will get a little tingly. And that's just one way to kind of put your mind into your hands. The other thing I like to think about is that in my fingers, I can put my brain there, or my mind, so that when I'm touching with my fingers, my mind is there. And this is just a way to trick your brain into being into that spot. If you are trying to do massage and you have really long fingernails, this is not going to work for you. So you can do like your knuckle, or you can take a little pen or something. Pens are actually harder than your knuckles, so you just want to be a little more gentle. But you know, it's your body, you can regulate the pressure, right? So, and then while you're doing massage, make sure that you're going slow and that you're breathing. And you want to not push past the layers of tension. You want to feel the first layer of tension, like right where you feel the tension and the pain, and then take your time and sink into it. And that's how the body will respond. A lot of people are like, oh, I'm just going to get in there and jam in there. And the body is not like that. The body likes like a slow, even release. If you are doing what I'm showing you and you get dizzy, we have a lot going on right now. If you're working in the upper body, there's a lot of emotions that get stored in here. For most people, the jaw is about resentment, right? I kind of resent these things. But a lot of people, it's just like their general response to stress and tension. Like I said, that upper body, like you're breathing with these muscles here, and the tension shoots into there. So just to kind of think about like, oh, I'm massaging, sometimes it gets a little bit too much. Just stop, take nice deep breaths, drink a sip of water, and then just see how you feel. Overall, like when you're doing all this massage stuff specifically for your jaw, it might take us longer while we're doing it here together because I'm teaching you, but you should be doing like 3 or 4 minutes. Even 5 minutes is kind of a long time to be like rubbing in these areas, because there's just not, I mean, there's strong muscles here, but there's not a lot, right? So you want to take your time and just not do too much. Does anyone have any questions before I move on to actually showing you how to do this? Okay, great. So the first thing I want to talk about is some acupressure points. So if you look at your hand and you've got these 2 fingers here, see if I can get this in the right light. And you have these 2 big knuckles. It's getting a little bit washed out. You get these 2 big knuckles. If you drop your finger down into the next little hole right there, in between those 2 knuckles, there's a point here. It's called triple warmer 3. It doesn't really matter what it's called, but this guy has a channel that goes all the way up through the neck and then lands right here. So both sides have this point, and I use this a lot with acupuncture to actually help alleviate jaw tension, and it works pretty well. So between these 2 fingers, you stop at those big knuckles, and then you like let 1 finger and you drop in, and it should be a little bit of a sore spot, like right there. And you can do both sides. And so just like 3, 4, 5 little pushes here. If it's really sore and you work on it for a little while, then the soreness should actually kind of alleviate. That might actually help. So again, this goes all the way up into the jaw. So that's triple warmer 3. Then on the side of the hand, you got your pinky side, right? Let's see. So if you put your finger here and you bend your wrist like you're trying to chop something, right? Your finger should fall right into a hole there. And if you just kind of dig around in this section, you'll find some little bones and some kind of squishy spots, and just push for the bone. So like here for me, this part of my finger is pushing up against a bone, and there's a bone this way. So there's like a hole, and all acupressure, almost all acupuncture points are in holes. So if you're kind of feeling for the hole and then just dig around and find the sore spot, this is small intestine 5. This is a really good point for neck pain and tension. And you can also, like, while you're pressing it, kind of and just see, like, hey, when I'm pushing on this, does this make a difference in my jaw or in my neck? And kind of move around and see. For some people it does. So again, you can just kind of like 1, 2, 3, 4, 5. You could push on this 10 or 15 times. It doesn't actually matter. I'm just trying to give you a number so that you're like, okay, if I do this 5 times now, I know I can move on, right? Did everyone feel like they kind of got those points there? And did anyone notice a difference? So like anyone say, oh, I pushed that and I felt it in my neck or jaw? Okay. Yeah, it doesn't work for everyone, but I wanted to point those out. Then the other point that I would use is, look, large intestine 11. So on this part of the elbow, this is the outside, right? If you look here and you look at it, usually there's like a little line for there's the folds. And then you just let your finger kind of drop towards the elbow and there'll be a hole right there. And for some people, it's really tender and other people it's not. If it's tender for you, it'll probably help. But this is a good one. And it's, again, both sides. So this is a large intestine point. So this channel goes like this. And it goes all the way up the side of the neck and actually goes up through this part of the mouth. Because the jaw is this whole section here. There's muscles in here. There's muscles in here. So we're not just working like that one little spot where it tends to get sore. So large intestine 11. So if you just spend 1 minute pushing on these little spots before you get started, it basically opens up the energy flow and helps everything start moving in the area that we want to work in. So I find that if I go away from the spot first and then work on the spot, it works a lot better. Then next is, I don't know if you can see, so this collarbone, right? If you feel on top of the collarbone, it's pretty uncomfortable in there. Like most people don't like to be pushed in there. So that's not what we're doing. We're actually going to drop down right underneath and we're going to find the space that's right under the collarbone. So if you can kind of see, I'm pushing up against the collarbone. And for most people, it's a little tender in there. So, and if you just kind of like work your way over, you can look for some sore spots in there. But for most people, what I'm looking for is kind of like right where the neck comes down. If you draw a line from the side of your neck and then drop your finger, this is usually the point that we're looking for here, because this is the stomach channel and this comes right into this section here. And remember, you can use like a knuckle, you could use a thumb, you could use a pen, like whatever is helpful for you. So you can kind of rub these guys and find the sore spots. Then if you go on your neck here, there's a big old muscle right here, and this is called the sternocleidomastoid, SCM for short. Does not really matter what the name of it is. What matters is that you can come in and kind of grab it. And so I like to grab it and feel on either side of it and squeeze. And it's pretty tender for most people. Now, you do have a bunch of arteries and nerves and all kinds of stuff running through here. So on the front of this muscle is usually like where you know you're trying to take your pulse, right? If you feel your pulse, just don't push hard right there. If you're only pushing on one side, you're probably not going to pass out. But if you have any kind of heart condition or anything, just like be careful. So if you're worried about it, just skip this part. But I think it would be uncomfortable enough that you probably would not end up injuring yourself in any way. So, or you can always push on the back of it. So I just like to kind of grab, and usually this part right here, the meaty part, is really uncomfortable, and this directly relates to the jaw. So then you kind of just grab down and then do both sides. And for me, it's really, really tender in here. So you can use one hand, which is harder to see, or two. And then you can also just kind of rub behind the ear. There's a little section back here, and it's all probably pretty tender spots. So you can push, 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 push all through these spots. And I would probably go about this slow. Okay. And then remember to breathe. So I haven't been breathing because I've been talking. So for me, I can already start feeling things moving just because I've been poking around in here, so I can feel the energy starting to flow into this area. it could be very subtle for you. You may not notice it. So then the next thing is we've got this cheekbone right here, right? If you kind of run your fingers through here, you know, you got this big old bone, like if somebody were to punch you in the face, is the one that gets broken, right? So there's basically underneath this bone, and then you got your jawbone, right? In this little section is a muscle called the masseter, and it's basically a square-shaped muscle, and the fibers run like this. So a lot of times in massage, what we're actually trying to do is called cross fiber friction. So if the fibers are going this way, we want to go this way. And what that does is it breaks up what people sometimes call as a knot, which is basically what that is it's metabolic waste or glue, like whatever you want to call it. They get kind of like glues the fibers and the muscles together. And so if there's a million reasons why this happens, not really worth getting into, but essentially what you're wanting to do is go this way across the muscle. And you can press pretty firm in there, actually. And you'll feel there's more bone and hard stuff in here, but you can still press in all of this. So I go this way, and I'm actually doing it a little bit fast, but I'll go like this. And most people's faces have enough grease on them that you don't have to use lotion. You could put lotion or something on here, or grapeseed oil works really well. But if you don't want to clog your skin up, you could just use your fingers and just make sure you wash your face later. But so you see how there's like the bone, and then right underneath the bone, you're gonna push, push, push. I also like circles here, like this. We're going like this. Oh, I forgot this point on top of the shoulder. So the other thing is this point really right here is really good for jaw tension also. You would not want to use this point if you're pregnant because it stimulates labor, but for most people it's pretty safe. So right here on top of the shoulder, if you look, you see there's the highest point right there, right on the very top, or you can even kind of grab it like that. If you push down straight on the top, then there's usually a really hard tender spot right there. This is called gallbladder 21. And this is another channel that runs right up through here and runs right through the jaw, and it actually runs through the side of the head as well. So it's really good for stress and tension in general. It's usually pretty sore in most people. You could just kind of like go across the top of the muscle here and open it up. So let's see. Okay, so then you can see I'm already all red from where we were pushing in here. Then the next thing is this muscle right here. A lot of people get headaches in here. A lot of people get headaches from pain and tension, right? It's called the temporalis muscle, and it's a fan-shaped muscle that goes through here. So you actually, when you're talking and chewing, are using this muscle. So even if you like talk to yourself a little bit right now and put your finger on it, you can kind of feel it moving around, right? So same thing is that you can do little circles, and I'm pressing pretty firm. Like you can see my skin's moving around, right? Like this is me moving my hair, this is me moving my skin, right? So there's a fair amount of pressure in there. There's not a lot of tissue. This muscle's kind of thin, so you don't have to push like super hard, but you want to feel it. You want to feel the sore spots. So you're gonna just kind of go, and you could do both sides at the same time if you wanted to. I like to kind of do one side at a time, and just because both sides they'll be different. So you can go, and then I would stop right about like this part of the ear. Past that, you're not really doing much. So just kind of like if you look at the top part of your ear here, you maybe draw a little line with your finger. That's probably about where I would stop. But you know, you can just feel around in there. There's no like, you're not going to hurt yourself, but you feel like, oh, right there, it's really sore. So you're looking for sore spots. And when you find the sore spot, you can actually press on it and hold. You don't have to move right past it. I like to kind of warm things up by doing like these little circles slowly, like I was showing you, and then go, oh, okay, there's a sore spot. So I'm going to sit there and I'm going to kind of hold on it. I'm like, okay, I'm holding. Oh, you know what? Okay, it's not as strong now, right? Like the tension's kind of relieving. Well, rather than leaving that spot, you can actually press in a little bit further. So each muscle has about 5 layers of these little glue spots where there's soreness and tension. And so you can often sink into that same spot, depending on the muscle and a bunch of different things, at least a couple times. So I'm like going in here. Oh yeah, okay, there's a sore spot right there. And I'm just gonna hold it. And a lot of these spots are actually acupressure points anyway, but, and you can go like, move your jaw, mine cracks the whole time while I'm doing this. And just feel like, what does it feel like when I go? Does that relieve tension? Does it make things worse? Is anyone getting like a headache from this? Anyone getting dizzy? Anyone feeling anything that's not good? Okay, perfect. Plenty of sore spots. Yeah, exactly. So there's a lot to do. So like I said, 5 minutes, but 5 minutes is actually kind of a long time. So if you're just like doing all these things, 5 minutes should be pretty good. You can do it like twice a day if you wanted to. Probably most people aren't going to do that. Let's see. Okay. So now here's the big stuff. So these are all really important. Then, I don't know if you're gonna be able to see, but inside, I'm gonna show you the inside of my mouth because that's the kind of person I am, but there's muscles on the inside here that are a different set of muscles than these outside ones. And these are a main culprit in jaw tension, and they do not feel good to work on them. They hurt. However, the gold is in there, right? So if you look in your mouth and you go in the mirror, you will see 2 lines. And like, if you ever see like a skull, like on a cartoon talking, you can kind of see these lines, right? Like, you can also open your mouth and go under your cheekbone and push straight back in, and you'll find a really sore spot in there. Did anyone find that spot? I don't know if this is showing up on camera, but yeah, even if you close your mouth and push back like this, you can kind of find it. Okay, so this muscle is called the pterygoid. It's got a really weird spelling. It's like Pterygoid. And I'm just telling you the names of the muscles, not that it matters to know them, but some people are like want to nerd out and go look up all this stuff. And once you know the names and what you're looking for, it's easier to find other techniques, because I don't know everything. So this guy, here's the deal. You kind of have to open your mouth to get to it a bit. Like you can get to it without opening your mouth, but to really get all it, you got to open your mouth. But if you open it too wide, then you're causing a lot of tension. I can't really push on a muscle that's super tense, right? So you want to open it wide enough to get in there, but not so wide that it's creating tension. So it's kind of like a slack jaw, like, like if you were to like a mouth breather, you're just kind of like hanging out. That's kind of the right bit for it. You could do this on the inside of your mouth. If I do this on patients, I put gloves on and go inside there and I just hold. So I'm going to show you so that I don't have to talk with my finger in my mouth. It hurts like a lot. So I'm pressing pretty firm. You can press more firm if you go inside your mouth because you're not pushing through your cheek. But for your purposes, like even for me, I know how hard you have to push on this muscle, and it's pretty intense. Like even on myself, I'm not going to do it that hard just because it's like, oh. However, it's really worth it. So usually after you press down one side, you'll feel that this whole side kind of opens, and you're going to do both sides. Ow. And it feels almost like a bone for most people. Like it's a muscle, but it feels very solid in there. But there's a little bit of give, which is how you can tell it's not a bone. And when you come down, so there's a bone here and a bone here. So it's in between these 2 bones. And just feel. Ow. And then I like to open and close a little bit and kind of stretch it while I'm doing it. So like a minute tops, 30 seconds on each side probably. should actually do it. And I found that when I have this done on me, which is really uncomfortable, it's like I can almost see colors better afterwards or something. It opens up so much. So this, like, you could just massage this if you didn't want to do any of this other stuff and you just were like, God, my jaw's killing me right now and I just want to fix it. You could just go for this. But to really be like super effective, because all these muscles work together. There's no such thing as just these muscles. Like, I'm talking this whole time and all of these muscles are doing this job, right? So there's a lot going on in here. So that's why I showed you all these other things to do. Okay, so we showed you the pterygoid. I showed you the masseter muscle. The other thing is you can kind of do some pressure points in here. You can press on the outside of the eye. Like there's a bone right here and you can kind of push up against the bone. So if you go to like the tip of your eyebrow and then kind of drop your finger down, for me, there's a really tender hole right there. And then you can drop your finger down even underneath that. And there's like a spot there. And this is the base where the masseter muscle goes. And then you can come all the way back and then right in front of the ear, in front of your little ear flap here, if you open slightly, same thing with this, you want to like kind of relax open, you'll feel there's some holes in there. And then you can put some firm pressure in there. You see how my finger's kind of dropping in when I do that. So there's some acupressure points in there. The other thing is right behind the ear, there's a little spot here where you kind of like push in towards the jaw. This is Sanjiao 7 or triple warmer 17. There's a pretty sore spot back there. And then the other thing I like to do is actually pull down on the ear. You can pull straight down and then you can pull out and see if you notice that that opens up the jaw. Oops. Sorry, there we go. Okay. How are people's jaws feeling and are there any questions? Okay, that must be pretty straightforward then. So I'll just show you two other things. Oh, good, Brian. Yeah, I mean, your regular doctor probably isn't going to have a lot to tell you about your jaw. A dentist is usually going to have more to tell you. But you know, at least doctors can sometimes refer you to physical therapy and stuff. So, does anything that points make you feel nauseous? Okay, so if you're feeling nauseous, usually it just means you're doing too much, right? And for like right now with times where anxieties are really high, when you're working in the upper body, it sometimes is bringing the energy up too much. Also, there's a lot of toxins, like toxins is a broad term, but just we'll go with it for right now. They get released. So it's actually really important to drink water afterwards or even during, because we're breaking up the glue that's actually creating tension in here. And that glue is metabolic waste and it has to go into the lymph. So some people feel nauseous for that reason. Some people, I mean, there's a lot of things, like these channels all have emotions related to them. The jaw has all kinds of tension in it that could be related to like all kinds of issues. So there could be 500 different answers. If it's only when you push on one spot, Jasmine, what spot is it that you're pushing on? Is it like up in the jaw somewhere, or I can see you.
The coronavirus style. It's in here.
The one back here?
Yeah.
Yeah, that point is a pretty strong point, and I would say that like if it makes you feel nauseous, just don't do it. It's kind of a weird, like it kind of gets the salivary glands a little bit, so it's not necessary.
This one's fine on this side. It's just the one side.
You could play with it. I mean, it's your body. I don't feel like there's any wrong way to do this, but I will say that sometimes if you get nauseous or dizzy while you're doing this, like I have seen people pass out. Now, usually that's if they're sick or something else. So make sure you're sitting down. I don't think it's going to happen to you, but just know like, hey, if you're starting to feel a little dizzy, like, hey, take some deep breaths, drink some water and stop. Like you don't have to keep going, right?
Thank you. That's good advice.
Yeah. So yeah, make sure you drink water after this. Okay, the last thing I want to show you, because this is going to kick me off here in a minute, is PNF stretching. So there's stretching called proprioneuroreceptive something or the other. I never remember it, but PNF. And essentially what you're doing is you're going to go into a stretch. So like that's a stretch for my jaw, right? and you're going to resist the stretch. So I'm going to try to push my jaw up out of the stretch. So I'm going this way. So I'm pushing this way, but I'm only pushing like 20%, and I'm trying to keep it open about 20%. So it's not about trying it really hard. It's just about getting some movement in there. And you can also try to push your finger down and still try to bring your jaw up. So like I'm trying to close my jaw, and then I'm going to keep me from doing it with my finger here. And you're going to do it for 6 seconds. So try to open, 6, and then try to close 1, 2, 3, 4, 5, 6. And then that tricks the muscles into releasing a little bit. So, and you can look up, that's probably not the best explanation of it, but, and you can do the same thing with your neck muscles. So you're going into the stretch and then resisting the stretch basically with whatever it is that you're doing. And it works extremely well. Okay, I think that's it. Make sure you drink lots of water, wash your hands afterwards. I'm going to put this up on YouTube, and I will try to work on the closed captioning as soon as I can so that our hearing impaired people can get with it as well. All right, thanks everyone, and you're welcome. Thank you. Bye.